Nasal steroids decrease inflammation in the nose, which can reduce congestion, itchiness, and runniness. Nasal steroids are one of the first drugs that I prescribe in someone who's suffering from allergies, especially if someone is complaining of nasal congestion. They're safe for long-term use when used properly, and most people don't report any side effects from them. Once you start a nasal steroid, you should start seeing symptom relief beginning within a few days to a week, and you might see continual improvement for up to a few weeks or a month. The most common side effect from nasal steroids is minor nose bleeding, and usually we see that in patients who are spraying it the wrong way. So the right way to use a nasal spray is to point the nozzle towards the outside of your nostril. So if you're spraying it in your left nostril, think about aiming the nozzle kind of towards your left eye. I usually tell patients to hold the bottle in the opposite hand of the nostril in which you're spraying. That way you kind of naturally aim the nozzle towards the eye. Other very rare side effects of nasal steroids are sore throat and irritated throat. Nasal steroids don't carry the risk of short-term or long-term side effects that oral steroids carry. For example, nasal steroids don't cause weight gain, they won't cause osteoporosis or cause any mental side effects that sometimes oral steroids can cause. For patients who don't want to use nasal steroids, I will prescribe a nasal antihistamine, which actually have been shown to be just as effective as nasal steroids in preventing allergy symptoms. Nasal decongestants are excellent drugs to be used for a few days, but patients who start using these nasal decongestants for months on end can develop severe congestion, and they sometimes need surgery to get their nose back to normal.